Highley has 3 things on his wish list.
As I told Stacey, all she needs to do is get me to margaritas, beer, and apple pie, and I'll be fine.
Stacey Brill is his swallowing therapist. 10 years ago, Thomas was treated for squamish cell cancer of the head and neck. The radiation treatment damaged his throat. He hasn't eaten in years.
Everything I eat or drink is fed through a feeding tube.
3 times a week, Thomas and Stacey work on his eating motions.
Well, the first thing I do with any of my swallowing patients is I do a modified barium swallow. So I want to identify where the breakdown in the swallow is.
Relearning to eat involves strengthening those muscles that allow us to swallow. Therapy involves exercising the throat and neck muscles along with electrical stimulation.
When you swallow normally, your muscles will contract. So the machine's going to make them contract, and then the object is to swallow as much as we can while that's on.
The goal for swallowing patients is to get them off feeding tubes and on the least restrictive diet possible.
We can safely return them to drinking anything they want to drink and eating soft solids or even regular solids, and obviously that's absolutely wonderful.
The rehab clinic at Gulf Coast Medical Center has a 92% success rate.
You don't realize how much of your social network is oriented to eating and drinking until you lose the ability to swallow.
Thomas is hopeful that with swallowing therapy and hard work, he'll get his just dessert. For Lee Memorial Health System, I'm Amy Osher.